Welcome back to part 2 of Long Covid Breathlessness. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now working in Long Covid Services for 5 years. I post on all the usual podcast channels as well as on YouTube. I hope you've found them helpful and hope you find this one helpful. And if you do, obviously, click subscribe and hopefully share with anyone that you know who has long COVID. I want to get this out there to as many of you as possible. As I've said before, this is an educational series for those of you who are still suffering from long COVID. I have to add my usual disclaimer. Any advice I mentioned, should only be considered after talking to your own doctor. So let's get into it. Part 1 of this particular posting of breathlessness, I talked about the symptoms, what you're experiencing, and how we go about managing it, the history and examination, the investigations, etc. And then I went on to, at length, and I admit it was at length, and quite a lot of detail, into the causes of long COVID breathlessness. So here we are, now in part 2, and I'll talk about how we are going to tackle breathlessness. So basically a quick recap first of all. Shortness of breath or breathlessness is common. It's one of the big 3, I always feel, after fatigue and brain fog in long COVID. Yes, there are other sort of 10, 12 other really common symptoms, but I always consider fatigue and brain fog and breathlessness to be my top 3. Our patients are really a bit worried and surprised about it because it's unexpected, because majority of our patients are youngish and pretty fit and it's not what they're used to. And as a consequence, because they're not able to, go out for a run anymore, etc., or they actually have to stop halfway up the stairs to catch their breath, they find this worrying. And wouldn't I? I would, absolutely. And basically, it is a reality. It is common, like I said, and there are lots of causes for it. And basically, because we can categorically know the causes and demonstrate the causes, both with investigations and sort of scans, etc., we can actually say that this is a reality and it's not imagined. And remember, I did talk about the causes, as I said earlier, like in depth, but the causes are essentially the upper airways or the air sacs of the lungs or the blood vessels surrounding those air sacs, those blood vessels, that their function is to take the oxygen away and transport it around the body. Maybe problems in those blood vessels. The problem may be due to the nerve control of breathing, or it might be due to poor breathing pattern disorder. So, okay, the meat of the talk is how are we going to manage it? So basically, first things first, we want to optimize. This is the purpose of going to your doctor, to optimize the condition you might already have, namely asthma or COPD, chronic obstructive pulmonary disease. We want to obviously exclude other causes. So anemia. If you're anemic, you can feel short of breath because there's less of those red blood cells around, and so oxygen carrying capacity is reduced, so therefore there's going to be less oxygen being transported. So anemia needs to be corrected. There might be a blood clot on the lung, so that needs to be diagnosed and treated off to hospital. Inflammation of the lining of the lungs, the pleura, may need treatment. So remember, so inflammation, long COVID is all to do with persisting inflammation, isn't it? And it's not only those blood vessels, but it's all the tissues in the body. So the lining, the sacs, the sacs that enclose the lungs can be inflamed. Like you might have heard of pericarditis, inflammation of the heart sac, the pericardium. Then you can actually get, so that's pericarditis, inflammation of the heart sac. You can get inflammation of the lung sacs, pleuritis. And there's an excellent drug, an old-fashioned drug, an anti-inflammatory drug called colchicine. We use it mostly, conventionally, in treating of acute gout in those patients who can't have anti-inflammatory tablets, non-steroidal anti-inflammatory tablets. There is this colchicine, which has been around for hundreds of years, which is very effective at dealing with acute inflammation. Like I said, it was used mostly up until the last 10 years or so, only for gout. But actually it's used for pericarditis and also pleuritis. And I've had lots of patients who have been really helped and really glad that we've suggested this to their GPs to prescribe it for them. So that's addressing the chest inflammation, but also addressing dysautonomia and MCAS. So these two conditions, like as I said, listen to those podcasts or watch the YouTubes on those two conditions. But those two conditions can lead to breathlessness in long COVID. And so they need to be looked into and dealt with in their own right. And then that leads us on to dealing with this abnormal breathing pattern, this thing that I have called breathing pattern disorder. Well, referral on to a respiratory physiotherapist, a physiotherapist who specializes in respiratory breathing conditions, would be a good shout. So that would be a referral that your GP could make, or you could approach a respiratory physiotherapist yourself. Their function is to sort of help you understand what best breathing is. Okay, so best breathing is slow, deep breathing. What we call belly breathing or diaphragmatic breathing. Okay, so diaphragmatic breathing, that the diaphragm is that big muscle that divides the chest cavity from the abdominal cavity. And so this is a muscle that is responsible for about 70% of the actual breathing, the 70% of the movement of the chest to expand and contract the lungs. So belly breathing, diaphragmatic breathing is the correct breathing. The incorrect breathing is the shallow, rapid breathing, the sort of, if you like, panicky, hyperventilatory type breathing, where you're using the accessory muscles of respiration. So the neck muscles and the shoulder girdle, and it's a sort of a rapid, as I said, shallow breathing. That's the abnormal breathing. That is breathing pattern disorder. It then becomes, you learn it. It becomes a bad habit, if you like, and that becomes your default way of breathing. The sort of the rapid shallow breathing, and you have other sort of telltale signs like yawning and sort of gasping. Those sort of signs are also very, very suggestive of breathing pattern disorder. So how are we going to do it? How are we going to deal with this? Well, I think first things first, I've already covered that. I've brought it to your attention that breathing pattern disorder is to do with the different types of breathing. Good breathing, bad breathing, best breathing, not so good breathing. So best breathing, that sort of slow and deep breathing. So how can we learn that? Now, if you focus that in your mind, we can sort of, if you like, think about breathing when you're breathing. One of the sort of tips and tricks is to learn something called box breathing. Box breathing, what is that? Or rectangle breathing, or window breathing. So basically find yourself a square, look at it. Maybe you're looking at a screen right now. You're computer screen is a rectangle, isn't it? So you can track around the edge of the square, the box, the screen. Okay, so and basically when you sort of take a deep breath in, you basically go down the side, and then as you breathe out, you go along the bottom, and then as you breathe in, you come up the other side, and then as you breathe out, go along the top. And this is crafty, because it's better than a box, a square box. Because it's a rectangle, then the long side is the expiration, the breathing out. The short side, the downside or the upside, is the inspiration. It's better to have a longer exhalation than inspiration. Okay, have you got that? Short breath in, and then long breath out. Short breath in, long breath out. That is box breathing. So if you can sort of focus on that, say when you're looking at the TV this evening, box breathe around the TV, or sitting at the traffic lights, box breathe, waiting for the red light, waiting for the green light. You can box breathe whenever. So you're just basically trying to learn or relearn how to breathe properly is really what I'm trying to say. So you're learning correct breathing. Another tip and trick is sort of what we call unweighting the chest. Take the weight off the chest. Again, it's a bit sort of odd, isn't it? Because you don't really think, oh, my chest is feeling heavy or weighty, etc. But if you unweight the chest, then that eases the breathing. So if you're seated, you basically lean forward and put your elbows on your knees or on the table in front of you. So you're unweighting. So as you're sort of leaning forward, there's less weight on the chest, and that makes breathing easier. Likewise, when you're standing, you can lean forward, maybe on a stick, or lean against the back of a chair, or a shopping trolley, for example. You'll see that if you go around the supermarket tomorrow, you'll see people who might have breathing problems, be it sort of chronic obstructive pulmonary disease. They'll be leaning forward, won't they? Actually, whilst they're leaning forward, they will be walking along, and then they'll stop, have a breather, and then walk on. So there we are. Another tip and trick is the pursed lip strategy, if you like. So breathing out through pursed lips, tight lips. So and imagining if you're blowing out a candle. When you're blowing out a candle, you have your lips pursed, don't you? To blow out the candle. So basically, if you keep your lips out, then that controls your breathing. Yeah. Another is blow as you go. So take a deep breath in before you stand up or undertake a task, and then blow out as you do the task. Okay, so blow as you go. Breathe in and before you go, blow as you go. So those are some sort of crafty little tips and tricks that you can use to help with your breathing pattern disorder. Yeah, box breathing, pursed lips, blow as you go, and remember, unweight your chest. So there we are. That brings me to the end of this second part of breathlessness in long COVID and how we're going to manage it. So I hope you've found it helpful. So remember, safety first. Report any new problem with your doctor. COVID blind? No, you mustn't be. Know the causes. Yeah, we've gone on through the causes. It's important to understand for your validation, and how we manage it. We treat any conditions, and then on to breathing pattern disorder, incredibly common in long COVID patients with their breathlessness. So this is only part of the package, of course, in recovery from long COVID. We've got to remember those other strategies. Remember the bigger picture of long COVID. The PPP for fatigue management, that is pacing, planning, prioritizing, and planning. Okay. Remember gentle reconditioning with, say, yoga, for example, or focus with sort of mindfulness, and that's good for stress management. Then there's sleep hygiene we've got to think about, of course, and diet. Of course, it's not related directly to breathlessness. However, a mixed balanced diet is so important in recovery from long COVID for many, many, many reasons. So there we are. An update on breathlessness in long COVID. I hope you found it helpful. And as I said at the start, this is an educational series for you long COVID sufferers. But remember my usual disclaimer: any advice and treatments that I've mentioned, discuss with your doctor. Remember, always safety first. So, if that's been helpful, obviously, click subscribe. That's what they always say, isn't it? Yeah, why though? I'm not because I want to get the numbers up. No, because I'm not gaining any advantage or benefit from this, because there are no ads, advertisements, and there's no monetization. No, I've turned all those off. I just want, if you like, my reward is to get these messages, this education out to as many of you long COVID sufferers as possible, because certainly it's here in the UK at the moment, loads of the long COVID services have been withdrawn, and it's left a lot of you pretty sort of vulnerable and unattended to. So anyway, like I said, spread the word, share. Thanks for any feedback. Again, like I said at the start, apologies. I just haven't got time to respond to all your comments and your queries. I wish I could. I just haven't got the time. It just makes my heart bleed when I hear those queries, and I think to myself, I could be helping so much, but I just haven't got the time to do it. So sorry. Keep them coming in though, because that helps with me with my future posts. So anyway, so there we are. Long COVID breathlessness. In the meantime, I wish you well. I wish you well in your long COVID recovery. So there we are. Good. All the best to you all, and see you next time. Cheerio.